Okay, Craig, if we just wait for the room to fill up and then we can get going.
That's fine. If you just tell us when you think we're full.
I will do. There's a few familiar names on this list. That's nice to see.
It's quite scary not being able to see the other people who can see you.
Yeah, it's peculiar. Okay, the numbers are still just creeping up a little bit. Just waiting to see. I can see Dennis from the NCOAA on there. I just wonder whether Sharon might end up signed in there for some reason, but no.
Adrian, I just sent her the link. She's having problems logging in. She'll join us shortly.
Okay, super. Okay. Well, should we make a start, please, Craig?
Yes, please. Okay, so good afternoon, everybody. Good morning to those of you who are on the other side of the Atlantic. Welcome to this workshop, very kindly put together by Adrian and Natalie this afternoon. My name is Craig Drinkard. I'm the National Fire Chiefs Council Carbon Monoxide Prevention Lead Officer. And I would love to sit and chat about carbon monoxide all afternoon, but we've got a really packed agenda. I'm really privileged to be able to introduce this. We've got some fantastic speakers. I'm really excited to look at some of the opportunities. I'm just going to introduce Adrian, allow him to introduce himself, and then I'm going to give you a bit of housekeeping, and then we're going to start the first presentation. Thank you.
Hi, everybody. I'm Adrian McConnell. I'm head of charity at the CO Research Trust. We're the I guess the UK's principal CO research charity. We've been running for about 15 years. We've recently rebranded. We were previously the Gas Safety Trust, and now we rebranded because we wanted to highlight the focus we have on CO research. Our focus has broadened slightly in that in addition to funding research, we're looking to promote sort of collaboration and coordination of CO related activities. And this is one of the first events in that series. I could go on for much longer, but I'm not going to. I know that she's just got in the room, so I don't want to startle her, but I'm going to hand over to Sharon so you could say a few words about yourself and your organization.
Thank you so much. My name is Sharon McNabb. I'm president and founder of the National Carbon Monoxide Awareness Association. We're honored to be part of this very great work and also groundbreaking exercise in bringing together the fire service from 2 different continents. So this is very exciting for us. We're a very small organization. We've been around for 6 years, but we have really great strategy that covers multiple industries, and we're working through that strategy to create a coalition that we're going to launch later next year. So looking forward to working more closely with all of you, and thank you so much for the good work that you're doing.
Brilliant. Thank you, Sharon. And like we said, we've got a really packed agenda. Please, for the people watching, if you have any questions, put them in the chat bar. Hopefully you've got an opportunity to see the agenda, and we'll call you in to be able to answer those questions in the question breaks. We've got some fantastic speakers, so without further ado, I'm going to hand over to Professor Andy Shaw for our first presentation. Thank you.
Okay, thank you. I'll just get the presentation sorted, I hope. Hopefully you can see that. Please let me know if you can see that. The presentation that's up there. Yeah. Okay,
yes.
Brilliant. Okay, thank you. So yeah, I'm Professor Andy Shaw. I'm from Liverpool John Moores University, and my role at the university is I head up the BEST Research Institute, which is Built Environment Sustainable Technology. It's a mouthful. But today, I mean, actually what my day-to-day job is, actually I do a lot of work with energy from waste. So I'm actually trying to produce lots of CO in that instance, or I'm actually looking at using microwaves for sensing and different things. So CO is something that's more of a passion of mine, and it started back when we first looked at this back in 2011. The presentation will show you more of it. So what I want to look for and what the presentation is, some of you will have seen some of this before. It's where we started and where we ended up. And I presented it in Maine 2 years ago now, 2018, actually 3 years ago now. My goodness me, time's flying. But anyway, let's get on with it. With a packed agenda. So what the aim of the CO stuff that we're doing is a national study of low levels of carbon monoxide exposure in dwellings. So it's not necessarily the acute levels, it's the chronic levels and chronic exposure that we're looking at. And it really couldn't have been done without the collaboration with, it's actually the FRS is here, so the Fire and Rescue Services. So we have Merseyside, West Midlands, Bedfordshire, Cornwall, Oxfordshire, Suffolk, West Yorkshire Fire and Rescue, and also COGDEM and LASCAR. Now, they didn't all join at the same time, and I'll go through as I go through the presentation. So let's start the presentation. So the first thing, my goodness me, 10 years ago now, was the pilot study. So from January 2011, 2012. And the aim at that point was simply to look at what the possibility of long-term low-level exposure was and looking at trends. And the way we did that was using both in Merseyside and Coventry first in the city centres. So no rural areas, just purely in the city centres. And fire crews were naturally going in and they were doing what's called home fire safety checks, to check for risks for fire. At that time, they also added a couple of extra elements looking for carbon monoxide. So it looked primarily for, is there a carbon monoxide alarm, not the black dots, so not the electrochemical one. It was an actual alarm in there. And the other one is all the crews had ToxiRays, which is this device here. So this device is a personal calibrated single gas, so it's CO only devices. And at that time in 2011, crews were not using this. In fact, very few people were using this other than those that may be in sort of the industrial areas. So with this, it would give you instantaneous CO reading as the crews go in. It would also keep and record a maximum level of CO. So when the fire crews would go and do their normal home fire safety check, they would take lots of different readings about the property in terms of occupants, age of the occupants in the, when chimney swept, things like that. But the other things we really wanted them to look at is, was there a CO alarm, and was there, what was the level of the CO, the maximum level of CO on these little ToxiRays when they've been in there. They would then put that onto a tough book and then upload it to our data. And all we were doing primarily was just the analysis of it. Let's get to what they found. So within the Liverpool City region, the crews within that 12-month period went into 22,182 properties. And in the Coventry, in a similar period, they started a little bit early in December 2010. They did 5,147. So quite a decent amount. The reason for the differences is just the way that the fire and rescue services were done and how they picked the properties. They were picking these properties as they would do normally, their day-to-day business. They weren't making any sort of prejudgments in where they were. So they were the ones who were going to. And different fire and rescue services, and this is probably the big thing with this, would do things slightly differently. Merseyside were trying to do a blanket cover, Coventry a little bit more targeted in the properties they go to. But for us, it was just collect data and see what we get. Oops, right. So if we look at this, the easiest thing to see how good our data set was, let's look at the cooking and heating source. So what you've got on here is heating source on the left, cooking on the right. Predominantly, it's always gas or electric. There were very few inner cities that would be wood burning stoves. That's probably changed now. But back in 2011, it was predominantly gas. And as you can see down at the bottom on the table and here, the dual gas cooking and heating is about 77%. And that's about right for the national average on there. If we look at the next, oops, hang on, I'm going back one. Let me go back. I'm jumping around here. Apologies. So 75% for Liverpool. So if we go down, what we could then do is, they would naturally be looking on the home fire safety check for smoke alarm ownerships. So what the easiest comparison to do is look at those homes that had smoke alarms compared to those homes that have CO. And the little bar graph you can see on here that's on each of the wards within the city region. So on the left-hand side, just past the cream area is the River Mersey. And then you've got the green bars indicating that the house and properties had green sort of smoke alarms. And on the orange is for the CO. And there was some study just before this was released and we did the work that reckons there was about a 30–40% ownership. What we found here within the Liverpool City region, only about 9.8% of the properties actually had a CO alarm. On the thing that actually 80% or nearly 80% had dual fuel gases. That was quite alarming at that point, that actually CO alarms were obviously not as prevalent to smoke alarms at that point. I think there's a bit of a delay when I do this. Okay, if we look at Coventry, similar kind of things. Look at the Coventry wards. This was even starker. Now, the kind of areas Coventry were targeting when they were doing this was obviously a lot of what we call indices of multiple deprivation. So basically really deprived areas or deprived wards. And you can see the green bar again of the smoke alarms and the orange bar on that. And you can see with this point, the CO alarm ownership was only about 2.9%, so really, really low. However, the dual fuel still existed. It was still about 80% of properties. So there was a lot of properties that didn't even have a CO alarm, which is a bit of a worry, obviously, for any acute poisonings, because nobody would be alerted at the time. Okay. Now then, for some reason, it's jumping to, I do apologize when I'm doing this, but anyway, okay, let's look at this. So we're looking at the Toxi-Ray readings when the crews had gone in and come back out again. Now, it doesn't sound much, but out of 22,000 visits from the Liverpool region, 49 had a non-zero reading on the Toxi-Ray. And you can see it ranked across here. So the horizontal axis, you can see the maximum ppm reading. So there are probably about 10 of them higher than 10 ppm as CO, and majority were less than 9. Now, that's not massive. There's only 49 out of the 22,000 at 0.22%. So what's that to do with? Well, let's just compare with Coventry first, if it will let me. So there's the Coventry. So at the 5,035, so slightly higher percentage, again, had non-zero readings. So the problem with this is when we looked at it, is we said, well, why would that be? We'd expect something a little bit more than that, maybe not quite as drastic as that. But actually, a lot of it is down to the times the crews were going in. They would go in after rush hour in the morning, and they would leave before rush hour in the evening. When you go in there, most of the appliances will be switched off as well, because you've got the fire service guys walking around your house. So maybe there's something to do with that, the time of day that they went in. So the next phase, I'm going to hate this because it's still doing 2. Let me go back up, was to actually try and put data loggers in to see and leave them in the property for a 2 to 6 week period to try and see what the reality was. Are we seeing any sort of movement of CO, or were they true readings that the majority of them are basically zero, zero in the property? So there's no CO in the properties. Okay, when we looked at it back in Liverpool, so 109 data loggers went into that period, and as you can see from there, from the data loggers back, none of those 109 actually had zero readings. There were always something. The worrying ones are the 24 there that had max greater than 50 ppm, which is your threshold for your alarm. This is not saying that that would have had an alarm sounding on there because of the characteristics of the way that the alarms are done. You've got to have 50 ppm and greater for between 60 and 90 minutes before an alarm for acute poisoning would appear. But there's something there, there's something going on that we need to look at. And if we looked at Coventry, which did 64 loggers, same thing. There were very few that had purely zero, but there's still quite a proportion of them that had greater than 50 instances, which is quite a high spike. So really, we had to drill down on what that spike was. If we look at the kind of profile that we saw, this is a single property on here, and you can quite see. So this is carbon dioxide ppm up the left of the vertical axis against time across the bottom. And you can see it's in December, so it'll be one of the winter months in here. But you can see quite periodically, you'd see these big spikes appearing. Now, those spikes were not long enough on there above the threshold to trigger an alarm, but there's consistently background CO there. And actually, when we the crews asked the occupants, it's pretty much when they were cooking. Quite often, certainly in the UK, they'd use like the high level grills. So where you've got your gas hob on there, and then it's up in the top, and the grill over there. And that actually we know is a good source of CO because of the way that the flames lick back and then cool down, which gives you your partial combustion. Therefore, you get the CO levels on there. So there's quite a bit there that we can then say, right, okay, what's that impact on the health? Well, the first thing to do is like, let's look at more. And the second part of the study, the phase 2 and 3 between July 13 to April 18, This is with the Gas Safety Trust now forwarded this with 250 data loggers supplied by COGDEM members and LASCAR, and also 2,500 CO alarms in there. The idea being is what we do is try and tempt the occupant, or at least the fire service would tempt the occupant with a CO alarm fitted in there and then place the data logger. Quite obviously, we're trying to make sure, because there's so few properties have CO alarms, if there is an event, the CO alarm will sound and then they can call the helplines and just leave the property on there. At that point, it was the fire and rescues joined us, so we could then look at more of a national way of looking at this. This is try and get more rural areas, not just purely city centre areas. That was the idea, and we had a few on there. The concept, well, if you look at this is a graph of the UK. The dots on here, the coloured dots, the different colours are different fire and rescue services who did these, but you can see dotted around, still centred quite a lot around the city centres, but a few of them were more in the rural areas, which means you can have a look at it. Unfortunately, when we timed this, it was the point of where the financial crash and austerity measures. So actually, we didn't get anywhere near done as many as we wanted to. But in total, from 2018, we had 496 readings that we could then look at these data readings in the properties on there. And if that's just the data distribution, so you can see obviously Merseyside and the West Mids had already done quite a few already, and that's who they added on there. They could do a few more. The crews were geared up. West Yorkshire, Bedfordshire, they tried their best, but obviously they had other operational reasons for not being able to do them as many as we'd hoped at the time. But we can still make some good conclusions. I wish you would stop doing this. So when we looked at the ones from the new one to 2016, we're seeing a very similar profile. This is just one at random. Again, you're seeing these big spikes that are going well over what an alarm threshold will be, but not necessarily the alarm. And obviously there was a study done by Ben Croxford in London that looked at this, and the best way of studying these is do something called a time weight average, and that is you average this over a set period and look at the levels of the carbon monoxide exposure. And the World Health Organization actually has oh goodness me, going the wrong way. Trust an academic to get a presentation on here. Never mind. Okay, so looking at this, these are the levels set out by the WHO guidelines for the air quality, and what it's saying is 87 ppm for 15 minutes. There becomes a health detriment. What the health detriment is, we're not saying in this. We're just getting the data for it. 30 ppm for 1 hour, 8.7 for 8 hours, and 6.4 for 24. So if we simply just average 15-minute average time, 1 hour average time, 8 hours and 24, and then we look at the threshold of those peaks, and what will happen naturally is the peak will reduce because we're averaging over a period, and we can try and see what the peaks are. And if we go down one more, this is what we find out. So out of those 496 data loggers, purely at random, you've pretty much got the majority of it. Oh, goodness me. 93% of them on the blue and the yellow, with no significant ones. Basically, they're within the World Health Organizations, but there were 4% that weren't. 2% was 30 ppm or higher, actually getting close to the acute, but not quite. But 2% at 8.7, which still has a health reason, but it's for 8 hours. So especially when COVID hit, you'd imagine with 8.7, it could have had a health impact. We're not trying to say it has, but that's effectively what the data loggers show. So if we look at it in summary for what we've done, hopefully I'm not too far on time. Have I been going too long? So the summary is on here. So according to the Office of National Statistics, there are about 27.2 million households in the UK. And this breaks down on the people on here. We found 4%. If the 4% is true, and I'm not saying it's because we need more data loggers really in the properties, it would potentially mean there are 2.3 million people at risk of chronic exposure to CO. So that's enough CO to cause you health risks. How am I doing for time?
You're done. There's your
I'm
time.
done. Okay, there is more, but I'll leave it at that. That's the summary for the data loggers. But without the fire and rescue services, none of this would have been possible because they were the feet on the ground actually going into these properties, collecting the data. All we were doing was just simply analysing the data on it. So, okay, I'll finish there. Thank you.
Sorry, just before Craig steps in, can I just say, if the speakers are all happy, after today, we will share all of these presentations on our website so that all the presentations, PowerPoints will be available if all the speakers are happy. So Craig, over to you. You're still on mute. Okay, I can't hear you. No, he can't. He can't unmute. Okay, so the next speaker we have is Pat.
Hi, let me share my screen then, please. Okay. Right, can everyone see the presentation? I'll take that as a yes. Okay. Okay, so I'll start with a brief overview. So I'm Patrick Meehan, I'm Station Commander at the West Midlands Fire Service. I'm delivering this presentation for Brindley Mills, which will come on to the second slide. So our job in the West Midlands Fire Service is to keep 2.9 million people safe in the West Midlands. We serve a diverse population across Birmingham, Coventry, Dudley, Sandwell, Solihull, Walsall and Wolverhampton. We're the second largest fire rescue service in England and cover an area of 902 square kilometres, which include areas of the highest risk in England outside of London. We operate 38 whole-time fire stations across the West Midlands with over 1,200 firefighters working to make the West Midlands healthier, stronger and safer. Okay, so this is Brindley Mills, the picture on the right. So Brindley Mills is the watch commander and he is also the West Midlands Fire Service carbon monoxide lead. So due to our status as trusted members and with success in other areas of collaboration work, CO work, we should be enabled to take on a more prominent role by increasing our CO home safety remit, working closely with other partners, and the West Midlands Fire Service can use local knowledge to tailor CO safety campaigns and target different demographics within each area. Data collection by the West Midlands Fire Service should be shared with consideration of co-designing future approaches and opportunities. So common vulnerabilities of CO. As a fire rescue service, we are keen to target those most vulnerable to the fire and so vulnerable to fire and other emergencies. If we look at CO research, Trust Strategy 2021-25, and look at the demographic of those most vulnerable to CO exposure, these include groups such as elderly, possibly with care packages, children who are yet to be educated on risks in the home, and those living in fuel poverty. It shares a remarkable similarity to those at risk from fire. Okay, common vulnerabilities. So West Midlands Fire Service serious incident reviews show those characteristics and individuals who are most vulnerable to fire. And as we can see, it shares a common audience with those most susceptible to CO exposure. There are three areas which are quite remarkable, as those with care packages. These individuals engage with a lot of professionals agencies and yet still account for a high percentage of incidents. Those living in rented accommodation, whether private or sheltered, still account for a disproportionate number of incidents. And as we can see on the previous slide, are more likely to be living in fuel poverty. And finally, smokers. 25% of incidents involve smokers, which is remarkable in these modern days, but show further intervention is required from all agencies to prevent fires and CO exposure through education and intervention. Targeting those most vulnerable is a constant challenge, but to enable us as a fire and rescue service to rise to these challenges, we must trust in a data-led approach, utilising tools such as Vulnerable Localities Index, Mosaic Profiles and Serious Incident Reviews. Coventry Joint Strategic Needs Assessment brings together evidence about health and well-being of Coventry residents. This helps leaders across health and social care understand and work together to improve health and well-being for the people in Coventry. Collaboration with linked agencies and trusts to target those common vulnerabilities. partnerships with health providers to target those at risk and reduce risk in the home, improving quality of life, sharing best practice with other fire and rescue services like we are doing today, and understanding that a combined and consistent approach of CO awareness and prevention is best practice. Education through schools and home visits, targeting unique demographics such as new communities and elderly and those that are living in rented accommodation. West Midlands Fire Service collaborative projects. So since 2012, the West Midlands Fire Service have actively led and collaborated on a variety of carbon monoxide projects. These are the three with the most impact to date. So 2012, achieving Marmot status. 2018, neuropsychological effects of chronic low-level carbon monoxide exposure. 2021, identifying and protecting pregnant women from exposure from carbon monoxide exposure. Release of the Marmot Review 2010, sorry. Following the release of the Marmot Review, Fair Society and Healthy Lives, the West Midlands Fire Service have engaged with local authorities to formulate the Coventry approach. So the project overview. Once the approach had been agreed, 6 identified beacon authorities were divided into 3 programmes. Programme 1 was Greenwich and Sheffield, which was improving health and leadership. Programme 2 was Durham and Sunderland, frontline staff and health. Programme 3 was Coventry and Merseyside Fire and Rescue Service, reducing preventative deaths. Coventry fire stations were to monitor CO readings as part of their safe and well visits. The West Midlands Fire Service researched subject matter and identified best practice regarding Programme 3. Through this, we formed links with Merseyside Fire and Rescue Service, Liverpool's John Moores University to agree a joint set of questions which are sympathetic to both regions and relevant to their home safety and prevention based activity. We jointly identified additional equipment to be used to detect CO and advise a localised training package for all Coventry crews. This identified the need for a recording mechanism and referral pathway identification, which we still use today in the West Midlands Fire Service. Achieving Marmot status. Initially, this pioneering piece of work was collaboratively undertaken by Coventry City Council, West Midlands Fire Service and Merseyside Fire and Rescue Service to develop a methodology to identify the number of CO poisonings going on unreported back in 2011. More than 27,000 properties were visited during the study in Coventry and Liverpool, and on average, only 10% had CO alarms installed. The investigation helped save lives in both cities after data loggers picked up dangerous levels of CO being produced by boilers, cookers, and secondary heating appliances. In 2018, the West Midlands Fire Service were invited to collaborate with Lancaster University, looking at neuropsychological effects of chronic low-level carbon monoxide exposure. The aims of the project were to examine the extent to which low levels of CO are present with a sample of homes in Coventry, determine the associated neuropsychological and physical effects of low-level CO exposure, determine the associated impacts of exposure on outcomes such as quality of life, falls risk and healthcare use, determine the extent to which intervention by fire and rescue service in reducing levels of CO in the home results in measurable changes functioning over time. To enable research, a sample of 106 adults aged 60 and above were recruited by the West Midlands Fire Service through safe and well visits. The following method was then applied. During safe and well visits, residents 60 years and above were invited to take part in the study, investigating possible health effects of sub-alarm levels of CO in the home. Fire officers revisited individuals to place data loggers and CO alarms in the home. Participation information sheets and expression of interest form was given to sign, and where agreed sharing information and contact later by a researcher. It's followed by a phone call from a researcher to arrange an appointment to answer questions. Then was a visit from the researcher to consent to get the consent form signed, and an initial assessment was carried out. The fire service then to collect the data logger after 1 month to download, and then the data was downloaded and combined with health data for analysis. Fire service must revisit homes for further intervention to place data loggers in for another 7 months, and then the consent form was repeated and follow-up testing. Okay. The research impact. Okay. The new knowledge that we have gained from this research so far will provide a valuable contribution to scientific knowledge in this research area. There'll be an impact on policy, it will inform the design of CO alarms. It will influence the work of fire rescue services and the NFCC in preventing risks to older adults. Produce information for charities such as Age UK and gas engineers to educate, improve awareness and protect individuals, and identify whether CO is a potential risk factor associated with risk development. This is a valuable piece of work in a relevant and unexplored area. Further research and exploration are required to support Breath Cheshire's research. So CO exposure and pregnant women. This is the latest collaborative project to involve West Midlands Fire Service and consists of a quantitative study with a maximum of 400 participants and a further qualitative study with 60+ women and their families, plus 30 to 40 local and national stakeholders. There are approximately 650,000 live births in the UK or England each year, about 4,700 perennial deaths, 3,200 stillbirths, 1,200 neonatal deaths. Of this figure, 1,500 would be classified as unexplained deaths. It is unknown if any of these deaths were a result of a pregnant woman's exposure to CO. The women and families we expect to benefit from this, mostly from this work, are from lower social, economic and disadvantaged groups. Again, I will refer to some of my earlier slides when targeting these most common vulnerabilities. They are most likely to be living in lower quality private rented accommodation, less aware of the dangers of CO exposure, less likely to consider CO poisoning as a priority, and are less empowered to improve their living conditions and less able to act if a problem is identified. The aim of the project is to establish what levels of CO are present in the homes of pregnant women by monitoring CO over a 2-week period, establish whether breath testing at the time of booking can be used as an indicator of exposure in the home based on any positive breath test readings, obtain household data and personal CO exposure data amongst pregnant women through these methods, assess any changes in CO levels in the home and personal exposure levels after safe and well visits, understand the levels that pregnant women are exposed to in the homes and evaluate against potential risk and harm. Nearly there. How are we getting on for time? Nearly there.
Yeah, you're just about at your time, but you've only got
Okay,
2 slides to carry on.
Last 2 slides, okay. So CO exposure in pregnant women. So CO exposure in pregnant women, the research impacts is a better understanding of scaling of the environment and CO poisoning in pregnancy, the barriers and facilitators to identification, how to better protect women and their unborn child, protocols and pathways for identification, treatment and removal of harm. And finally, the last slide. West Midlands Fire Service recently refreshed its CRMP to include reducing of health inequalities. The West Midlands Fire Service Community Risk Management Plan, reducing health inequalities. The aim of this objective is to enhance the upstream approach to firefighting through the development of a coordinated suite of activities that reduce health inequalities, therefore reducing the risk of vulnerability to fire and other emergencies. These activities will be across life course and with an aim of creating a more resilient communities. The West Midlands Fire Service continues to lead the way in CO awareness and education, with data collection already forming part of our safe and well visits as standard, with a snapshot CO reading undertaken at every safe and well visit. It's hoped that through our further collaboration, we can introduce carbon dioxide awareness into our state-of-the-art interactive safe side sites based in the West Midlands. Our East Side Centre is an experimental learning centre for children, young people and adults, and feature our immersive full-size indoor safety village. It has several scenarios, including a bank, house, road, shop, police station and canal. It allows children to learn about real dangers within a safe and a controlled environment. Finally, thank you very much for the invite today. And hopefully I didn't go over too long.
Brilliant. Thank you, Pat. And thank you to Andy. Typical time for my Zoom to decide it doesn't want to let me unmute. So thank you, Natalie, for jumping in for me. Please, any questions for that, put them in the chat. Hopefully fire colleagues will be looking to West Migs about how they can maybe develop that in their own service. I'd like to hand over to Emma Fraser, please, from London Fire Brigade.
And I was muted as well. I'm going to try and share my screen now, so give me 2 seconds. Can you see?
Yep, we've got that, Emma.
Okay, just get it into okay, there we go. Oh, it seems to be sharing it in a strange way. I'm not sure if you're seeing the same thing that I'm seeing, but okay, well, first of all, my name's Emma Fraser from London Fire Brigade, and thank you for inviting me along. First of all, so I'm going to talk to you today about the carbon monoxide residential boat project that we've been working on. So I'm just going to give you a bit of background on this. So we were approached by a group of people, including what was then the Gas Safety Trust and the Boat Safety Scheme here in the UK, to conduct a research project about houseboats.
Emma, I'm sorry, I'm not sure if you're supposed to be moving on your slides, but we can see your sort of editing page with all your slides down the left. And
I don't know why it's showing that. Display settings, swap presenter. Sorry, I'm not sure why it's doing that.
Emma, I think you need to enable editing. There's a enable editing button on the screen underneath the toolbar. So you might need to click that and then it will let you.
Not let me do anything. I've got a completely different vision than I've normally seen. Give me two. Shall I end it and start again? Sorry about that. I don't want to, I know you were short on time.
That's okay.
I'll stop sharing it. I don't know why it's come up like that. I've never seen that before. In 2 seconds. Sorry about this. Enable editing. I'm going to get rid of everything else that's open and see if that'll help with you.
Never worked with children, animals or Zoom.
Oh, yes, absolutely. It does. It seems to be just wanting to show all my notes, which is not necessarily what, because you don't need to see that. I'm so sorry about this. I'm just gonna, because it looks completely fine on my screen. I'm gonna unshare and then reshare again. I'm gonna try something slightly different. So I've come out of our brigade. Try something and then I will.
That's coming back now. We're all going to see your password.
No, you can't. I'm going to try doing it on within our system. That might work better. I was trying to do it outside because we often have, in case it crashed or anything, but what I'll do is,
That's it. You've got it, Emma.
You've got it. Okay, brilliant. Let's start again. Just to give you, I've given you a little bit of background. So we were approached to talk about, to look into doing a research project by what was the Gas Safety Trust and the Boat Safety Scheme to carry out this research project. And one of the reasons that was first of all, we've got over 5,000 boats moored along the canals and waterways in London. I know we're obviously very famous for the Thames, but we have a whole network of other canals and everything, Grand Union Canal and so forth. And we attend as a fire and rescue service around 60 boat incidents a year. So we have a network of doing home fire safety visits across our area, so to speak, just as the other fire and rescue services do in the UK. We carry out around 80,000 home fire safety visits, and some of those have been in the past on boats. But obviously, as you'll know, as you'll be aware, sort of the risks that are on boats are slightly different as they are on land. But we've sort of been trying to carry them out in the past. One of the things that we wanted to do, there's this big perception that those living on boats are more at risk of carbon monoxide poisoning. But when we were in early on conversations, what we wanted to do was find out whether this was actually true or not, or whether it was a perception that we were all holding due to the known risks. So as I say, we were approached to sort of look into this research project, and as we were already carrying out these home fire safety visits, it was something that we thought that we could sort of progress. We needed to drill down exactly why we were doing the project and what were the things that we wanted to know and what did we want to come out of it. So we did some work around this and identified 4 key questions. These are, what are the demographics of those living on residential boats in London? Again, there's perceptions that we have some very, very wealthy, huge, glamorous residential boats, and we have some where people, the cost of house prices in London is astronomical, and we have quite a number of boats in different locations which really shouldn't be on the water and are definitely not inhabitable. We wanted to know, are they at greater risk of fire due to factors that are currently unknown? Obviously, we're attending these fires and we need to make sure that our crews are as prepared as possible when they go into these situations. And obviously, we wanted to know, are they at greater risk of carbon monoxide poisoning? Is this something that, as I said, is this a perception, or is it actually is this actually something that we can prove through data? The last question we wanted to answer is around the risk of carbon monoxide poisoning for houseboat residents. Is this something that's seasonal? Is this something that we have more incidents in the winter due to heating and different practices there, or is it more in the summer when we've got windows open and therefore you've got engines running? And there were lots of questions that we just don't know the answer to. So the aim of this project is to try and answer those. In order to proceed, what we needed to do was to look at the numbers of potential visits and locations and where would we carry these out. As I say, we've got a huge network, but they're a very small proportion of the residents within the city. So what we did is we did some work with the Canal and River Trust, and we wanted to get a bit of a range of different types of moorings. As I've already said, there's lots of different types of boats across London. So we wanted to look at some of the long-term moorings, but we also wanted to look at some of the 2-week. We have quite a number of 2-week moorings where people are moved on from location to location, and obviously these vary in the sort of condition of the boats. So after that, we went into consultation with our borough commanders. So the way that London Fire Brigade splits its station grounds are, we've got 102 fire stations and a river station, and we're spread across 33 boroughs, and we split those 33 boroughs into areas. So we've got a lot of, so rather than going in and having every area involved, it wasn't really necessarily appropriate if they didn't have waterways in that place, on their grounds. So after lots of sort of discussions with them and looking into their risks, the other risks on their grounds, we identified 33 of these fire stations across 16 boroughs that were going to participate. Once these were done, we were able to identify all of the resources that we would need from the grant. Sorry, wrong key. So what we then did is we put together a bid to the Gas Safety Trust, who are now the CO Research Trust. We put together a grant of what we would like to do in order to carry out 1,457 tailored house visits. Seems a bit of a random number, but it was based on the capacity of the station grounds that we were going to be working with. We consulted with the boat safety scheme in terms of what they would like us to do. And we will be working with Liverpool John Moores University, who you've heard from a number of times already, of their involvement in projects. So in December 2018, the funding was agreed, and we were able to employ a full-time member of staff to assist myself in running this project. So what do the home fire safety, these specialist home fire safety visits include that we wanted to do? They are tailored specifically advice for residential boats, and they include fire, carbon monoxide and water safety advice. The home fire safety visit will involve the provision of a logger, which I'll talk about a little bit more in a moment, a carbon monoxide alarm and a smoke alarm, as well as the accompanying literature. The tailored advice, obviously, as I've said, is very, very specific to the risks on houseboat residents. And we created a new piece of literature, a residential boat safety booklet that covers all of those very specific pieces of information. On our standard home fire safety visits, we give out something called Fire Safety in the Home booklet, which covers all the advice that's given to a resident. So they've got it in literature so they can look at it at a later date. We also created some new forms that we could do that would capture all the additional information on these tailored visits as opposed to the standard visits that we do. The equipment that I said, so the provision of carbon monoxide alarms, they've got a very specific British standard, which is specifically for use on boats and also in caravans, which is the one on the screen, BS 50292-02, and the provision of a logger. We want to provide each of the residents with a logger which will record the CO levels over a period of a month. These are then, the residents also provided with an envelope in which, a padded envelope in which to send it off to Liverpool John Moores University for the analysis of that data. And we in order to comply with all of our GDPR and all of our data protection information, we didn't want that information, the personal information of the residents, to be sent off. That stays with the Fire and Rescue Service. The data we collect in the course of the home fire safety visits and on the loggers will then be tied together by our member of staff to look at trends and to look at how whether there are, in order to answer the questions that we set out earlier on, whether there are seasonal variations and so forth. In order to equip our crews with to make sure that they were fully able to identify the risks, we produced some guidance notes for them. So we've done, on the left you'll see the one is specifically around this grant funded project, but what we didn't want to do was leave ourselves open so that the support was there for crews in other areas who came across houseboats that they wanted to carry out a visit for. And also at the end of the project, we wanted to give it some longevity so that these home fire safety visits could continue further into the future. So we've produced two pieces of guidance around those. We also produced a training video. It's about 15 minutes long. And again, there's a second version of that to give longevity to the project going forward. That will be is then incorporated into LFB core business for carrying out those visits. I'm coming to the end of this. I'm aware that I'm sort of running out of time, so we couldn't do this without the support of our partners, and so promotion of the work that we're doing. The Port of London Authority already use our residential boat safety booklet as a good practice piece of safety advice, and it's on their website. And a lot of the agencies that are here are a part of the London and Thames Water Safety Partnership, which we currently chair. And we talk about, so that we can promote that. The Canal and River Trust will be doing a huge promotional piece once this all kicks off. Sadly, the status of the project is currently on hold. We were due to start in April 2020. our start date was the 2nd of April, which obviously we went into a lockdown 1 week before. So everything is all in place for this. And we've had to delay the start. We are hoping to start in April 2022. And the reason we couldn't start and stop with this is that we need, in order to have the data that we need for a successful project, we need 12 months worth of data to take into account the different seasonal variations and the different impacts that could have on our readings from the loggers and the information collected from residents. And what we didn't want to do was start the project. So hopefully we'll be in a position to start all of that off again in April. Everything is in place, and as soon as we can press the switch, we'll be doing a big launch on that. And that is pretty much it. There's my email address. Obviously, we said we would circulate these at the end. I'm going to come out of my screen, she says, hopefully. And I think that's all from me for now.
Brilliant. Thank you, Emma. And thank you for getting through the slight technical difficulties at the beginning. It just seems that Zoom wants to mess with us, and it's just typical that COVID seems to be disrupting everything, even fantastic research projects like that. And now we've got some time we're a couple of minutes over, we've got some time for some questions. So we have had a couple of questions in. Adrian, would you like to ask your question, please, for Andy and also for Pat?
I would. I think one of the advantages of being somebody who's organised this thing is you can get, a couple of questions in before everybody else does. Well, I think if I start with Emma, thanks for your presentation. I know that this project has been a very long time in coming. I don't think I had children when you first started, but anyway, I was just wondering whether it'd be possible that once it's underway, and perhaps this time next year, we could perhaps have a smaller, similar event where you could update us, because I know particularly some of the guys here for some of the northern states of the US, I think that some of the stuff that you're going to be looking at is going to be very, very useful to them. And there's a number of them who may have some information and some experience that I think would be really useful for you to speak to them. Certainly the one of the presentations, the first presenter after this break, Kelly, she's got a whole wealth of information. So I think it'd be good to put you two in touch. Pat, I just wondered, because I had to look it up myself, but for our American attendees, I wondered if you could you mentioned the Marmot Review in your presentation. I just wonder whether you could very briefly just let our fellow attendees know what that was.
Yeah, so the Marmot Review, so Professor Sir Michael Marmot was asked by Secretary of State in 2008, I think it was, to first look at creating a report for fair and social for fair societies and healthy lives. So it's about reducing inequalities, really, and it was set into 6 different areas. So first one was giving every child their best start in life, enable all children, young people and adults to maximise their capabilities to have control over their lives, create fair employment and good work for all, ensure healthy standard of living for all, create and develop healthy and sustainable places and communities, and strengthen the role and the impact of ill health prevention. So basically, a bit of a mouthful, but basically it's about bringing equalities to probably more likely to socially and deprived areas where it's recognised that there's lack of engagement with children, education. So when they go through education, they're not necessarily equipped to deal with life, and equipped to actually go to university. And it's even like in the deprived areas where you've got adults, where you've had numerous generations where no one's been in work. It was about accessing these people and identifying these people. And then, so as a West Midlands Fire Service, amongst other agencies, we applied for Marmot status. So somebody, not me, had to write a paper about how we were going to do it. And it tied in with what we do. Is our core roadmap, really. So it's about protecting vulnerable people, keeping them safe, and we've adopted making our communities healthier, safer, and stronger, which is this is a fallout from the Marmot Review. So it's a list of guidelines which is based on research, and it's about, you know, bringing our communities up to where they should be.
Great.
Does that answer the question?
That does. Thank you, Pat. If you're going to indulge me, I'll ask one more, then I'll hand over the floor to someone else. Andy, obviously
Yep.
we worked together for a number of years, and I was, involved in the tail end of that piece of research. I remember you had the row of terrace houses up there at Liverpool John Moores University that looked how CO moved around a leak between buildings built to different eras housing standards.
Yeah.
And I used to run out of time there. I just wondered whether you could give us a quick, brief summary of that aspect of the work, because I think that's quite an important part of the puzzle.
Yeah, sure, absolutely. Yeah, no, it was at the end of my slides, but obviously I'd run over, so I couldn't go through them. But yeah, we're in a unique situation as a university. We have actually 5 houses now on site that are research houses. So these are fully built houses, but we can do what we want with them. So the Fire and Rescue Service came in. What we were looking at is twofold. One is how CO moves between properties. So if you've got a big CO acute leak in one, how quickly does it affect the adjoining property, especially when they're terraced houses, which is very unique within the cities. And the other one is that I know Mark Jones from FRS was looking at what about when we tell how people should react if they hear the CO alarm go out, switch the appliance off, open all the windows and leave. And what we found pretty much that we had to set a light to portable barbecues in the kitchen, had all the windows closed. We had the Fire and Rescue Service there with breathing apparatus on it. And we just watched with about 50 data loggers, sort of 15 in each properties with ToxiRays in there as well, and just watched how the CO went up and down. And the quite scary thing is what we found is, so in the kitchen where we set these off in the old 1920s house, obviously the levels got ridiculous, 40 or 50, which does part to where people, actually when I'm looking at cooking programs now, they're actually bringing barbecues in as part of cooking. And that's what worries me in that aspect, but that part of that to one side. But what we found in the bedrooms upstairs with the doors closed is actually, it would not go into an alarm event, even though it's 500 or 600 parts per million in the kitchen. So actually, if you did what people suggested, which is simply try and switch off the appliance, as soon as you open that door, you'd probably collapse before you got to the bottom of the stairs and incapacitated and possibly die later on. So it's quite a shocking thing when you start looking at it and how it goes. Now, there's a few caveats, but also the property next door, it's quite strange where you find the CO leaking in. It's not where you think it's going to be, but obviously it's the CO is finding the weakest point. So it got to an alarm event in the property adjoining within about half an hour of the property next door. So if that is purely electrically fed, you wouldn't necessarily have a CO alarm because you think electrically it's not an issue. But it's what, again, the old adage, what happens in the house next door causes the issues. I have got the slides and we can circulate the slides when everybody gets them and you can see sort of the kind of levels, and it is really scary on the kind of levels we get.
Great, thanks. Thank you.
Thanks, Andy. And we've got a question in from Simon Main as well. It's a question for you, Andy.
Okay.
His question is, when measuring the CO levels in households over a period of time, were smokers included? And if so, how was the impact of smokers on CO levels in a household taken into account?
So CO and smoking is taken into account, although the volumes of gas that's given off of a smoker is not as high as you would expect from an appliance of some kinds. Like, so that is obviously you only got a very small cigarette, but obviously when you've got a house full of smokers, then that can be an issue. And I know certainly, and I'm sure probably across fire, I know Merseyside were asked by the police to go in because there was a cot death in a property and the household was very heavy smokers and they wanted to confirm with the data loggers the kind of levels on there, but it was not proven. In terms of ppm on a couple of the houses that we did, there were smokers in there. You don't get much above 6 parts per million, which is beneath the threshold for the WHO guidelines. But it is something we take into account, and they do log if it's smokers in the properties when we're looking at it. But yeah, it is part and parcel. We're going to look for same as looking at roadside carbon monoxide ingress as well from heavy traffic areas. We can look on the site where they have, they've got a multi-gas analyzer that they use for Department of Trade, Department of Transport, beg your pardon, and we can use that to see what would be Yeah, basically, are we measuring the outside transmit in as opposed to purely what's in the house? But it's yeah, there's a lot when you start digging at it. There's so much that could be cause the CO that we're living with it pretty much every day. Yeah, isolating what's causing it is a big problem.
Brilliant, thank you. We've got a question in from John O'Grady. Again, for you, Andy, what plans do you have to continue the work that you so eloquently explained?
At the minute, I'm more supporting other projects. So the kind of thing I'm actually wanting to do is not so much, I think what happens with the project, we need more data loggers in there and a bigger one. So like some of the London Fire Brigade are doing with the boats, and there's another institution, NEA, did stuff with the houses and things like that. So it's all body of evidence. For me, I'm going back to what I'm doing, which is looking at centres and trying to improve the centre. Because at the minute, for me, looking at we're using electrochemical sensors in our alarms. You've got 7 years, some are saying 10-year lifespan. So I'm trying to see if there's a better way that we can produce a better sensor for that. So I'm being a typical academic and trying to find a solution to that, where we can have a mains-driven alarm that could be in there for the length we have with smoke alarms. That's where I'm trying to look at next.
That's brilliant, thank you. Adrian, we've got a couple of questions in from Laura as well, from AppCog. If you just wouldn't mind unmuting her and she can ask her questions, please.
Yeah. There we go, Laura. You should be able to unmute yourself now.
Oh, hello, is that working?
The system works, yeah.
Yes, we can hear.
Okay, that's great. Thank you all so much for your presentations. That was really interesting. I look forward to hearing more as the boat safety scheme project and London Fire Brigade project goes forward. So just sort of reflecting, it seems that, especially it was made very clear, I think, when Andy showed the kind of peaks and troughs of the background CO levels, it seems really clear that one of the important things is to kind of look at carbon monoxide levels over time. And I know there have been some initiatives of sort of testing after CO incidents, and that's been really tricky to get something reliable. So I just wondered if it's, now that we're moving to a stage in the kind of alarms world where we have alarms that can log background levels, and some of them can record, what the background levels have been over the entire lifetime of the alarm, would that be something which would be useful information for the fire and rescue service to have? So if you're responding to an incident, would it ever be the case that you would sort of think to look at the alarm almost as a piece of evidence? Would be my first question. And then secondly, it's around that sort of greater question about, I think the pilot, the studies of the smaller areas are brilliant, but obviously what we really want and what would be so helpful is if we can get a kind of national data set together. So I'm aware that there is some data that's reported to the Home Office, and that kind of happens in a unified way. So I just wonder if there's an opportunity for looking to kind of coordinating our coding or whatever it is to get those bigger numbers around carbon monoxide incidents, and showing what the brilliant role that indeed the Fire and Rescue Service does indeed play in keeping people safe.
Thank you, Laura. Adrian, do you want to maybe respond to them, or anyone else on the panel?
I can take part of it, I suppose. Thanks, Laura. I mean, I think, yeah, it's a more coordinated approach. I mean, I think as we've gone along, I think that's actually started to happen. I know when we first looked back in 2011, there was different bits and pieces, but there was more of a concerted effort of trying to find a way in. In terms of the alarms that are in the properties a long time, you've got to be a little bit careful because they're geared up towards looking at more of the higher values, like pre-alarm, so over 30 ppm kind of things. But any data would be useful. How the fire service would use that, I'm not quite sure. I mean, that's obviously for those guys to reply back to. But yeah, I mean, you've also got to remember, and I think the people on the call remember, is how many times other services have gone in, so paramedics and stuff. I mean, there's been quite a few cases where they can be overcome by the CO entering a property. So if you've got something in the property that's logging and alerting you before you enter the threshold, at least it allows you to put on the appropriate PPE. But yeah, that's the way I would look for it anyway.
Thank you, Andy. We've got a question in from Isabella Myers. Adrian, please.
Thank you, Adrian. Thank you, everybody. It's been really good to sort of recap on all these projects that are going on. And to me, it's really obvious that the fire service is unique in that you can go in. You're generally willingly let into people's homes. I know not always, but most people, if they asked to go into people's homes, would get the door slammed in their face. But not only do you get in, but you're also able to provide advice. And I think certainly, we could conclude that the majority of the people will take that advice on board. And this is a really unique position to be in. So I was just wondering, how could the fire service really capitalize on this ability to then help us to sort of officially collect data where in terms of where you are able to direct the occupant to different safety personnel. So, for example, if you suspect a CO leak, you can say, you need to phone the gas emergency line, et cetera, but where is that recorded that on both sides that the referral has come from fire personnel? And likewise, but probably more so within the health service, we don't pick up data really from the health side as to whether it's been a fire service referral because of something that's been picked up through a home safety visit or some such. And likewise with the sort of the priority services, you're probably more aware of where priority services are not actually reaching people. And this element, I think, is really important. So I'm just keen to try and get the ball rolling on how we could make better and a more official use of this really important service that you provide. And then my other question, sort of moving on from that, was, how could you actually develop this data collection and on both sides, and really have the fire service as an integral link into being key to people's health and safety in their own home?
Thank you, Isabella. And I suppose really the quick answer to that is that's kind of my job as the NFCC lead person, to try and promote that amongst the fire and rescue services, to push it on the NFCC home safety agenda as well, and also to ensure that the fire and rescue services has been able to play its part. And I think the presentations we've heard this morning from Andy, Pat and Emma show that there are some pockets of really good work going on out there, and what I need to do is now develop that and to try and get other fire and rescue service colleagues to embrace that as well. And hopefully sessions like today will enable us to, one, be aware of those things are happening, to give us the contacts so that we're able to get in touch with those people who've already done that hard work, and to make sure that we push it out across the rest of the 49 UK fire and rescue services. I'm just conscious of time, so unless there's anything massively urgent, I'm going to have to call a really short break, I'm afraid, just like sort of 3 minutes to try and get us back on time. So if that's okay, and then we'll have a time to answer any questions after the next 3 presentations. Kelly, if you could be ready to go at about 13 minutes past 4 UK time. I'm not sure what that is in the US, sorry.
Hey, Craig, just making sure you can hear me.
Yes, we can hear you and we can see your presentation as well, Kelly. Thank you.
Thank you.
Just give it a few more seconds. It's just a little bit before 13 and I don't want to miss any of what you're going to talk about.
Yes, sir. Just wanted to make sure you could hear and see. Thank you.
Yeah, thanks. Okay, Kelly, well, that's 13 minutes past on my UK clock. So if you wouldn't mind, please, starting your presentation. Thank you.
Thank you very much. And thank you for the opportunity to join you today. And I appreciate the work you're doing with the fire service in the UK. And we at NFPA hopefully will be able to support that work and collaborate. I wanted to just kind of introduce myself. My name is Kelly Ransdell, and I'm a regional director within regional operations. And hopefully you know about NFPA, but if not, I just wanted to tell you a little bit about us. We are an international nonprofit that has been around for 125 years. Our offices are in Boston, but we have global affiliates, and we work across the fire service with many of our international offices. And so we are celebrating our 125th anniversary, and we are a codes and standards as well as an education organization that works to reduce losses from fire and also other hazards, specifically electrical safety. And we have been looking at a lot of the same issues that you're looking at and how we can work with the fire service, because they're such a great tool in the field to see what's going on and also prevent injuries and deaths. Hopefully you know this character. Sparky the fire dog did just turn 70, and so I wanted to say he certainly is one of our mascots that's been around, and he got a facelift this year. And so hopefully you utilize his resources, and you can always download activities and things from him. So I just wanted to mention that because many of you probably know Sparky the fire dog from the fire service side of things. And then we are just finishing up Fire Prevention Week. And as I talked to Adrian about how we could collaborate, we published Fire Prevention Week in October in the US, but many of our international partners also are involved in this campaign. And so we always post these materials online. And this year, it included information about smoke alarms and CO alarms. And I thought that was really pertinent because during COVID, when we had these lockdowns, we had the unique opportunity to look inside people's homes because of things just like this, for school, for work. And there were so many cases where an alarm may be going off and people had no idea or had completely blocked out the fact that they had an end of life alarm going on or an alarm chirping. And that could be for both smoke alarms and CO alarms. And then one of the things we found out specifically around the fire service is many of our fire service partners did not know the difference between a CO alarm alert, which would give 4 beeps, a T4 sound, and a smoke alarm, which was a T3 sound. And we use this as an opportunity to educate ourselves and then help to educate the community. So these are 2 resources that are available to you. Those materials are evergreen. So if you want to use them, certainly take a look at firepreventionweek.org and download some of those materials around carbon monoxide alarms. And then at NFPA, we talk about what's called the fire and life safety ecosystem. And this is that in order to have a safe community, all the different pieces and parts must work together. So you have the government responsibility, the development of codes and standards, certainly that investment in safety, making people make a choice to be safer. And that certainly ties in with CO alarms, as you were talking about. The fact that if you had electric appliances, but you live in a multifamily dwelling, you would, your neighbor actually could have something that had produced CO. If you didn't have alarm, you were at risk. And that certainly is one of the components that we're looking at. But then one of the components that's really part of this ecosystem is that informed public. That is, how do we get the message out to the public to protect yourself? Fire service does an amazing job, but we need consumers, the public, to actually take some responsibility for making sure they have working alarms. And especially with CO, this is one of my passion projects that for a very long time I've talked about carbon monoxide. with my job, and also personally with my family, we've had some incidences where this is such an important thing that I do not think the public knows enough about. And so by educating the fire service, we're able to then reach down to the public at the community level. NFPA does have a robust research foundation. It is its own 501c3. And one of the reports that came out this year was around CO detection. And this is a US-based research study, but I can tell you that it's very frightening that we have such inconsistency in the adoption of codes, but then also the usage of CO alarms. And when you talked about the vulnerable populations, the same here in the US as it is there in the UK, we're kind of divided up by region. And so on here, you have Joe Thomas. He's in New England area, the Northeast. I'm in the South. Kevin is the fire marshal in Michigan, which is the central part of the US. And then we have the West Coast, but there are different demographics by the different regions, just like you have the same thing in the UK amongst the different countries. And that is, how do we look at that and make sure that we're rolling out campaigns around that? So if you'd like to take a look at this, it's free online. If you go to nfpa.org, click on research and reports, you can access this report. And then we're following emerging issues. So one of those is, of course, keyless cars. We know that with senior adults, they have muscle memory where they would traditionally put a key into the ignition and turn it on. Now with new cars, you just push a button. There's a complete change. And we've had instances where people have, because the cars are so quiet, if they have hearing impairments, they may leave it running. We also have instances with self-starting cars, or that you can warm up, that they have started their car, they thought they locked it, and they actually pushed the button and started their car in their garages, which has then poisoned families. We also have been following things like vacation rentals by owners and people that go out for vacations, and the fact that you could be exposed to CO on your vacation. And certainly it can have catastrophic effects. And so talking to people about taking along travel alarms so that you have that protection. And I can tell you that I personally travel with a CO alarm in my luggage everywhere I go. Vacation, work travel, it's with me, because we know that there are hazards that our codes may not have caught up in every state. So how do we protect ourselves? And that came out of North Carolina. So I actually live in North Carolina, and we had a couple and also a young man that died in the same hotel room where there was a pool heater that was leaking CO into these rooms. And as a result of that, we had some changes here in North Carolina, but we're finding out that the daughter of the Jenkins family has been looking at this and just how many people are poisoned in hotels. It's very frightening. And so we have been looking at these, certainly the normal causes of CO, but then also some of these emerging issues. And then here in North Carolina, we have Duke University, and they have a hyperbaric chamber. And we've been talking to them about what are some of the hazards they're seeing. Certainly propane forklifts are one of the things that in a business setting, a lot of workers have been poisoned on forklifts in these warehouse settings. And then also there is an emerging issue around charging golf carts inside. And a lot of times, if you are lucky enough and you're responsible enough to have a CO alarm, fire departments are being dispatched and it comes in as a CO alarm going off, but it's actually the hydrogen gas coming off of the golf cart batteries. And so these are just some of the emerging issues that we're following that are in this CO space. Another one, during COVID, people were driven outside for longer periods of time. And certainly these patio heaters, many of them are propane powered, were used a lot more during the year, and they're used in closed-in settings. And so NFPA has been looking at what are some of the outdoor safety things that should be talked about for our fire inspectors, for the fire service, as you're going out and talking to restaurants and businesses that have been driven outside. And certainly as the new variant is surfacing, we feel like a lot of the tents and also these outdoor heating will continue across the world. We're seeing this. And so that's one of the emergent issues that we do have resources for. And we have an educational messaging document. This is free online. These are just some of the topics that are covered in it. And this is a great tool for you. There was a chapter added on fire safety away from home this year, and then 2 other chapters on pet fire safety and youth fire setting. And how it works is we have a committee, and they look at the messaging that we have. They review it, they check it against our codes and standards. The national partners are at the table. We look at the research that's out there, and we develop this tool that then the fire service can use to roll out to the community. So this is kind of like the Bible book of fire safety that you can use. And so you can find it at nfpa.org, click on educational messaging, and this is what it will pull up. It'll pull up this little screen that says get your free desk reference, and you can download it, you can print it. I actually have a printed copy that I use all the time, but it's a great way to see this desk reference, and I hope that you'll download it for usage. We also need your feedback, and one of the things Sharon McNabb and I were talking about is there are some messaging changes that they'd like to see, and so we're going to be making sure that those comments get put in, but you can certainly submit a comment to us year round, and then the committee will take a look at that. And then the messages are developed for educators and the fire service to use, and we want you to kind of read about what it says about the topics. Then we want you to build out messaging that relates to your audience. And so I wanted to give you a snapshot of what's in here. So chapter 3 is carbon monoxide, and it starts with what is the danger of CO and how do we describe it? That's something that we found in the US and certainly internationally, that we want people to know that it's a gas that can't be seen, it can't be tasted or smelled, and it's called the invisible killer. That's how we refer to it. And then we talk about installation of CO alarms. We talk about testing and replacement. We talk about CO within the home, and the fact that any of the gas appliances, fossil fuel burning heating equipment, and chimneys need to be inspected per the manufacturer's instructions. And we're finding that people will have an appliance installed and never have it checked. And so this is something that they certainly need to be aware of. We also have a chapter around motor vehicles, because that certainly is a hazard that's developed, and then appliances and how we want to make sure they're having them serviced and also checked. And then, of course, portable generators. And we work with several of our federal partners. One of them is the U.S. Consumer Product Safety Commission, and they had made a change to say that portable generators should be at least 20 feet from any openings in a home. And so we had to wait for the codes process to catch up with that. The U.S. agencies worked together, and we were able to put in some new information around buying and renting portable generators, spacing of them, not sitting downwind. And then we take this information and we create safety tip sheets. And so you'll see in my PowerPoint, these are just some samples of our tip sheets. I was so excited. Just the presentation right before me was talking about boating and marine safety. And this is something that a few years ago we changed to make sure that we had information around carbon monoxide around marinas and boating. We knew that people were drowning. They thought they were just drowning, but actually they were CO poisoned. So we added information in our boating and marine safety section around carbon monoxide. And then we also added information, just like I showed you with the emerging issues. Many people are choosing not to stay in hotels, but actually rent out homes. And so we added information. One is our hotel and motel section did not have information about choose a hotel or motel that has smoke alarms and CO alarms and fire sprinklers. It said smoke alarms and sprinklers, but CO alarms weren't in there. And so we are trying to make sure that all of the different lodging options include information around CO. So both motel, hotel, peer-to-peer hospitality, which would be your Airbnb, vacation rental by owner, and all of those rental sites, motorhomes, campers, and recreational vehicles. People were quarantining in these, and a lot of times there were hazards there. And then within this section, there is safety in places of public assembly, and car fire safety is within that one section. So within hotel and motels, I mentioned to you that we added information around CO alarms, and that is a very concerted effort to make sure that people know that you need to take responsibility, because they may not always have the protections that are needed because you're bound by whatever government entity has authority there. We also talk about fire safety in these peer-to-peer hospitality. In here, we talk about the fact that all of these different things need to be addressed when you are considering renting from hospitality from another entity. And then, of course, motorhomes and campers. We talk about all the different sides of this. Certainly COVID amplified this because people quarantine in that. And also even within our fire service, if you were exposed at work, you were coming home and you would need a place to stay. And so they were using motorhomes and campers, but also they were alternatives for people that were vacationing. Instead of actually going and staying away, they take their home on the road with them. Also, we talked about fuel burning space heaters. This is something that's very widely available in the US, and people don't realize that some of these unvented gas-fired heaters have oxygen depletion sensors. We certainly talk about hazards of using unvented things. And then we have materials that we develop for you to download. So these are just some samples of our safety tip sheets that you can download. We have many around the topics we just talked about. And we also have translations and easy to read materials. And so I just wanted to mention that you can download if you're dealing with different populations. Certainly easy to read is a great way, which is basically pictographs to give information. And we have those around CO. And then we have a little toolkit that if you wanted to do some education around CO, we certainly have materials that you can use. And that's what I wanted to share with you. All these materials are free. They're all online, and if you have an internet connection, you can access them. There's even lesson plans. There's one around CO alarms in the home. There's one additional one, and this is the canary in the coal mine. We certainly have the story of how they used to send a canary into a coal mine to see if it was safe for humans to go in there. And we build upon that and how we've come a long way with CO alarms compared to when we used to send the canary in. And then we have information on CO poisoning. And as part of this, there's information about just how prevalent it is. And I think that's the most alarming thing is just we aren't even sure in the US and abroad how often CO poisoning occurs, but we know it can be catastrophic. We have a lot of free videos that are available to you. We certainly have social media. You can follow us at Sparky the Fire Dog and also the National Fire Protection Association. And then our partner at the US Fire Administration has social media cards that are interactive. And I would tell you that they let you co-brand. Even though you're in the UK, I can tell you these are some great resources that you can access that follows our educational messaging document. And they have pictographs. And I can tell you that we're really pushing out information around pictographs because it transcends all of our borders. And it certainly is a great way to communicate. I want to give you my contact information. Craig, Adrian, thank you so much for the opportunity to join you. With that, I'm going to turn it over to you, Craig, in case there's any questions.
That's brilliant, Kelly, and thank you. There's some amazing content in there, and I'll be definitely looking at it. If there's any questions, can we just before put them in the chat, and then Kelly, I'm sure will be able to answer them at the end. But yeah, fantastic, and happy birthday to Sparky, and happy anniversary to the NFPA. Can I now introduce Fire Marshal Joe Thomas, please, from Maine Fire Department. Thank you, Kelly.
Yeah, thank you for having me, everyone. I appreciate that. I think what I'd like to do is give you a brief sense of some of the things that we're dealing with here in the States as far as our exposure to carbon monoxide is concerned. One of the advantages that we do have here in the state of Maine is the fact that we do have a state law whereby we can regulate carbon monoxide detectors in certain circumstances. Now, that being said, I'm gonna pull up a slide program here, and if I can get rid of that. Yeah, hopefully you can see that all right. Here in the States, when we have the opportunity to regulate, it really is set by the fact that government here in the United States does not look favorably on our ability to regulate people's individualized homes. They are more inclined to be acceptable of the fact that we might regulate multifamily dwellings and apartment houses and things of that nature. But when it comes to an actual home setting, that's really the occupant's castle, and they can consequently pretty much do anything they want. However, as I said, we were fortunate in Maine to actually be able to develop a state law that requires the use of carbon monoxide detectors in certain types of occupancies. Now, this has not been an easy process. As Kelly mentioned, one of the things is we have such differences throughout the United States with different areas of the country. Now, in our case, our work with carbon monoxide detectors actually began back in 2009 with an initiative that was promoted by the Maine Professional Firefighter Association, my organization, the State Fire Marshal's Office, and the Maine Center for Disease Control. At that time, we had a champion from the legislature, a senator by the name of Bill Diamond, who had had an experience with carbon monoxide poisoning. And he literally carried the gauntlet for us as we worked our process through the state legislature to try and get the law passed. In 2009,
just to tell you, your slides aren't moving on. Sorry, just we're still on slide 1 on our screen. Apologies.
All right. Can you see it now?
Yeah, we're kind of on your editing screen, so we can see all your slides down the left, and then the slide 1 and the right.
Well, rather than take the time to do that.
Well, I think we were there now. I think we just got there, 2011 amendments, but apologies.
That's all right. In 2009, when we started the process of creating the law for the carbon monoxide detectors, we were able to get covered units in multifamily homes, any rental unit, a single family dwelling adding a bedroom, any renovated fraternity or sorority at a college or university, and any building that was converted to a single family residence. That was our first crack at the nut. That we knew we still had a lot more work to do, but when we deal with the legislatures here in the States, I think our strategy is to pick at the cracks that we get and work with what we have at the time, and then come back again for another round. And that's exactly what we did here in Maine. In 2011, we went back with an amendment to that law that then required carbon monoxide detectors in all single-family residences, hotels, motels, and dormitories built or extensively remodeled after August of 2012. We were successful with that, and that was our way to really get into the single-family residences. Now, how does that impact us here at the present time? One of the things that the state of Maine has, I guess you could say, a distinction of, is we are now the oldest population state in the United States. In other words, we have a large audience of people who are 60 years and older. Our younger youngsters have moved away to other states where there's more lucrative opportunities. And so consequently, we're seeing a significant number of elderly population who in the fire service, we know has always been a target population for us to be conscious of. And what we're seeing is, because of this aging population and our infrastructure of assisted living capabilities, Maine has developed a strategy of what we refer to as aging in place. In other words, people can, rather than going to other facilities like an assisted living home where they would be able to be provided services, they're staying in their own homes and they're trying to bring the services to them, whether that be healthcare, whether that be transportation, whether that be food and other types of services they might receive elsewhere. And consequently, what we're seeing is, from an emergency services standpoint, is we may be doing it effectively from a service perspective, but from a safety perspective, we're doing a lousy job. 62% of our fire fatalities here in the state of Maine are people 62 years and older. And what we also find is those fatalities, though in other circumstances might be one individual that's lost in a fire, we're seeing the husband and the wife both lost because they were incapable of getting out in the time necessary to safely get out of the building. The other factor that we're seeing into this is as these people reside in their homes on fixed incomes of limited abilities, we see that maintenance and other types of things that should be done to adequately assure their safety is not being done. And consequently, we're seeing furnaces that are putting out more CO because they're not being well maintained. And the exposures that we see are troubling. The second part of that is we know that without those proper measures of servicing being taken, we've got the potential for the real chronic low-level circumstances to come into play. And so our initiative right now is to actually work with disciplines and professions that have more immediate contact with this population and try to educate them and make them aware of carbon monoxide issues that can be coming into play. In fact, our most recent involvement has actually been with the state's Health and Human Services Organization and the Maine Agencies on Aging. And we're working with them to make them aware of the potentials that chronic low-level CO poisoning could be indicative of some of the circumstances they might anticipate leading toward diagnosis of dementia or Alzheimer's disease. And consequently, we're working with them to try and bring this awareness to the point where as the medical profession starts to analyze cognitive decline, one of the things that we'd like to see with them is actually the use of, as you refer to them, loggers, so that we could actually do an environmental assessment. So the environmental assessment is also part of the cognitive assessment that lead to an actual diagnosis of some of these issues. So that's really some of the types of circumstances that we're dealing with here in the United States and trying to partner with other stakeholders that can help us benefit those populations. And I'd be happy to answer any questions.
That's brilliant again, and thank you, Joe. And if there's any questions, please pop them in the chat and we'll get to the questions at the end. But again, thank you very much. Really interesting input on the fantastic work that you're doing there. Can I move on, please? And on your agenda, it might say that it's Simon, but don't be fooled. Hilary Bath, please, from the UK Gas Safe charity.
Oh, that's not the one I wanted. I'm doing well. Hang on. Here we go. That's far better. Play from the start. Come on. Good afternoon. Good morning, everyone. Hope you can hear me. And great that we've got the opportunity to actually discuss ThinkCO with you this afternoon. I'm just wondering whether or not you can actually see me. Yes, I think you can. ThinkCO. Yes, yeah, we can. Sorry, it's suddenly gone very quiet out there for it. As Craig just said, in an ideal world, it would have been my colleague Simon who'd be here with you this afternoon. He's having significant broadband issues this afternoon, so I'm sort of stepping in into his shoes this afternoon. It's great to have actually heard what we've heard already this morning about the data and the research and the awareness, certainly from the States. The ThinkCO programme really is very much about awareness more than anything else, as I'll touch upon in a moment. So our aim is to raise awareness of the sources, the signs and the symptoms of CO poisoning risks, particularly with frontline staff and volunteers who work in the homes of vulnerable people. So our target audience is not the general public. Some of our work and resources do touch upon them, but our target audience are those people such as fire and rescue service staff who actually go into people's homes, as people have been talking about. And it's actually funded by a national UK charity called the Gas Safe Charity. So our programme is multi-agency. We train frontline staff and volunteers from charities, the public sector bodies, the health service, fire and rescue service, housing associations and private home care associations across the UK. We have a particular emphasis on long-term low-level CO poisoning, that chronic poisoning that people have been talking about, but we do also cover emergency situations as well. And above everything else, what we try to do within the programme is that once someone is engaged with us, we want people to think about what steps they, their organisation, their team would take if they suspect that someone that they're supporting, someone that they're visiting in their own home, whether as a paid member of staff or as a volunteer, might be at CO risk, and what would they do in that situation. So we do this really, why we think it's important. From the work that we've done over the sort of 6 years of the project as it's actually developed the programme, what's really become home to us is that CO awareness levels are fairly low amongst staff and volunteers who work in people's homes. It's different with fire and rescue services, they're sort of a notable exception. But on the whole, the people who are doing that role, it's unsurprisingly the same as the general public's awareness really. When we ask them, and the feedback that we get is that most people have heard of carbon monoxide. In inverted commas, they know it's a gas and they know it's dangerous. But to actually know what the symptoms of CO are, and also how it is formed and how to spot the signs, far, far less frequently is that known. They also don't make the connection that it's actually useful to know about CO as part of their work or their volunteering. And what we partly do is to actually, through our engagement with them and their learning that we actually share with them, people realise that actually it becomes part of their toolkit when they're actually out there that benefits them as well as the person that they're supporting. They also, interestingly, and this is changing, the good news in this statistic is that it's varied. On the whole, people who are out there doing work actually don't actually know what to do if they suspect that CO is actually a risk. From the work we're doing at the moment, we think that about 35 to 40% of the organisations that we work with have organisational policies and procedures that include what to do in a suspected CO incident. Now that's a lot better than it used to be a few years ago when we asked the question, which is great. But by definition, it's still less than half of the organisations and teams that we actually work with. I hasten to emphasise again that fire and rescue services are a bit different here, but we're talking about all the other organisations and people that we talk with here. So it's really interesting that that is going up, but it's still not as high as it could or should be. And also people, when you talk about carbon monoxide and what work they could actually do in people's homes, they assume it's an emergency situation. They assume that the alarms are going. They assume that what they need to do is throw open the windows and call the gas emergency line. What they don't think about is the long-term low-level risks. And that's really why we concentrate it as the focus of our project. So our resources, we try to make them as accessible as possible. So all of them are free. We try to make them as inclusive as possible. We're a UK-wide project, so we actually take on board the differences within the 4 nations of the UK. We produce generic materials, but we've also started in the last couple of years to produce some targeted materials as well. And in particular, that's around people with hearing loss and also people where English is their second language. We also try to make it understandable with as little jargon as possible and as clear as concise as possible. No one will go away from engaging with a Think CO resource being able to go, oh, I could be an engineer. They may want to be, but it's not what they're going to go away doing. What it's about is just enabling them to actually understand better within their toolkit. So it enables them to do their role better. And we also try to make it relevant. So actually the resources, we place the key CO messages in the context of people's real working or volunteering lives. So our resources, we have until March of last year, we were running some half-day face-to-face workshops with people, and we'd run 80 across the United Kingdom since 2016. Inevitably, they went on hold as of March, which is why we produced the 1-hour Zoom workshop. We've currently run 53 of those across the UK since August 2020, and people are more than welcome to actually join us at one of those workshops. I'll talk about that and how to actually access that in a moment. And we've also got the e-learning course, which was actually cited on the agenda in front of you. It's about 45 minutes of learning. You can either do that in one sitting, or you can actually break it up into as many little bite-sized chunks as you want. But it's open to individuals to actually access the learning, or we actually have a SCORM version where you can actually put it onto your own organisation's learning management platform, and therefore you can make it available to anyone within your organisation. And certainly some fire and rescue services have done that. We've also produced some videos available and films that are available, and we've done that in partnership with Leicestershire Fire and Rescue Service. And those videos are in British Sign Language, in Hindi and in English. And we've also got a whole range of leaflets, posters, cards, resource packs, social media stuff, and that's all free. That really is our core resources of the Think CO programme. And the learning outcomes that we actually say, this, if you access these, this is what we can actually say is the outcome for you as an individual at the end. Our resources enable people to know about carbon monoxide and how it's formed. You will know about the sources, the signs and the symptoms of CO and how to spot those. You will know how to help prevent it, and in particular we concentrate there on the servicing of gas appliances in particular, though cover other appliances as well, but also about CO detectors. And you will also critically know what to do if you suspect that someone that you are visiting or supporting is at risk of CO poisoning. I would encourage you to actually take that back to your organisation and actually get those policies and procedures put into place for you, your team and your colleagues, so they know as well. So our current links with fire and rescue services. We estimate that somewhere in the region of about 250 to 300 fire and rescue people have actually attended a face-to-face workshop or a Zoom workshop on this. Now that's obviously a tiny amount out of all the people who are employed within fire and rescue services, but it's a great start. We've actually hosted workshops with a few fire and rescue services, such as those in South Yorkshire, Hampshire, Mid and West Wales, Leicestershire and Greater Manchester. And we have some links with Scottish Fire and Rescue Service and Northern Ireland Fire and Rescue Service in particular as well. And most of our attendees come from the part of the Fire and Rescue Service, which is about safe and well, home safety or community educator teams, but not all of them. We have had firefighters attend as well. The videos that I touched on earlier that we've produced in partnership with Leicestershire FRS. And what's interesting about all of those is that actually they've come out of requests that we've actually received from that particular fire and rescue service. Members of their Safe and Well team, their home safety team, have attended a face-to-face workshop or an online one, and they've contacted us afterwards and said, oh, do you do anything with people who've got hearing loss? Or do you do anything that's targeted at some of the practices within particular South Asian communities? And what that's ended up with us is working with them. We've actually produced some videos and some other materials that are targeted at those particular parts of our community. And we certainly use fire and rescue service case studies within our work and within our education. So we even have ones about crisp packets, we have ones about ash out of a coal fire, and we also talk about hoarders within our work. And all of those case studies are ones that FRS colleagues have actually shared with us. So some potential next steps in all this. We have started to talk with, and we really hope this is going to happen, to work with Craig and the NFCC and other interested fire and rescue services to customise the e-learning package that we've got out there at the moment to make it more targeted at FRS. We'd really value trying to do that over the course of the next year, and we'd like to work with FRS on doing that and work with Craig to make that happen. We'd like to promote the workshops that we've actually got. Every workshop that we get, including, we had one, I can remember, I think it was Northamptonshire Fire and Rescue Service, who we had quite a wizened older fire and rescue service person who'd been involved in the service for over 30 years. And he, bless him, actually said at the end of it, actually, I learned stuff in there that I didn't know over the last 30 years. So we'd really like to promote our workshops with your service, and also using your connections in the FRS with your local partner organisations and local community networks as well. We'd be very happy to run a workshop with your fire and rescue service as well, either in person or online. And there's the e-learning link. All you need to do is email us at that link, ask for to be registered, and we will actually send the e-learning course details through to you as well. I'm very happy to answer any questions post that either now or at the end of the workshop. Thank you very much.
Thank you, Hilary. And I've done one of those sessions as well, and I found it really, really interesting and engaging. And I can't encourage anybody from other organisations who are watching this to participate in them and to use the video. So just again, if you can pop any questions into the chat, and then we'll get to them after our last but by no means least presentation from Kevin, Fire Marshal Kevin Selmayer, sorry about my pronunciation, from Michigan. Thank you very much. Then there's stands on, but you're on mute, Kevin.
All right. Thank you, Craig. Thank you for the opportunity to be here today. It's been great to interact with all of you from the UK and from some of my peers from across the United States. Just to give you a little bit of a background on what we're doing here in Michigan. I am the state fire marshal for the state of Michigan. I've been in the fire service for over 35 years. I worked for a municipal fire department, a full-time fire department for just over 30 years, and thought I had retired. Was involved in a lot of teaching around the country, doing some stuff with the Principles of Modern Fire Tactics International Association of or International Society of Fire Service Instructors, and got this opportunity. It was reached out to by the governor to be the fire marshal in the state of Michigan back in 2017. So that's kind of how it all began. And when I say it's interesting of how it all began, is that I asked on day one to my boss of what do you expect me to, what are some things you want to see me accomplish in the first 90 days? And one of the issues that was clearly brought to the top was we were averaging over 100 fire fatalities in the United States in Michigan each year. And we were in the top 10 in the United States. And it was, hey, fire marshal, how are you going to lower fire fatalities across the state? One of the things that I looked to very quickly was to reach out to other groups across the state, whether it be the chiefs organizations, the fire inspectors, the fire instructors, the Firemen's Association, which was made up of volunteer firefighters. In the state of Michigan, we have 1,114 fire departments across the state, and we have about just shy of 26,000 firefighters that are spread across those 1,114 fire departments. So one of the things that we want to look at was collaboration, knowing that folks were doing a lot of great things, but we also didn't want to reinvent the wheel. So one of the things that we looked at was by getting all the groups together, and very quickly, it wasn't MI prevention at the time. It was actually the fire marshal's task force, as we looked at reducing fire fatalities, is what the group started as. We actually didn't become this brand MI prevention. You can see that up in the top corner of our logo. It has the state of Michigan. As Kelly shared, we're more in the central part of the United States. But like I said, we're number 10 in population out of the 50 states in the United States. So how do we come together, and how do we reduce fire fatalities is how we really started. And one of the things that we had to look at is we got, according to the latest census, we have 10.2 million residents in the state of Michigan. And I looked earlier today because Professor Shaw shared households. And I said, that's the good thing about having access to electronic devices today is we can get the information very quickly. We have 3.9 million households in the state of Michigan. So we started looking at what is this approach across the state. We have a lot of folks that are already doing things, what would some would say are fire prevention efforts. But how do we further educate, and how do we get our information out? So one of the things that we looked at is that we needed to, we put together this core work group. We had about 17 active participants. We developed a 3-year strategic plan. We rolled that plan out with the idea of how do we move forward. We were very fortunate in 2018, we received a grant from the United States Fire Administration. They're known as Assistance to Firefighter Grants in the United States. And we got one for $525 million to start $525,000. I wish it was $520 million, but it was $525,000 to start this effort. And one of the things that I figured out real quick was it was pretty hard to, if you want to say, oversee the whole fire service in the state of Michigan, interact with these over 1,100 fire departments. And that's why even on the slide today, I have Kimberly Pashkowski's name up there, that Kimberly was hired under the grant as a manager, and she was there to help us form MI Prevention. And that was through a group of collaboration. I shared about the 17 people that as it started, it continued to grow across the state. And today we have 466 partners, and that are all pretty active. They attend meetings when we have them. We've been doing a lot of that Zoom, of course, but they also, it's not just the fire service. And I think that was something that came up during the during the questions from the first session is that one of the persons who asked a question said, you know, the residents really open their doors to us. I mean, the fire service, you know, we knock on the door, or we want to educate, or we want to come in. We're welcomed into these homes. And so one of the things was, how could we leverage getting into the homes at the same time we could provide them this equipment? And that's where the $525,000 came in, to buy smoke alarms, carbon monoxide alarms. And then further, there was going to be education that came out of that, out of the funds. So we implemented that. We had the brand known as MI Prevention. We started out on social media. Kimberly puts out a daily message. That's one thing that I will say this, it amazes me how she does this. She is able to, every day she has a message, and it is going out on Facebook, it's going out on LinkedIn, it's going out on Twitter, it's going out on a couple other social media platforms, but every day there is a fresh message. And the reason that we moved towards that direction is that we had fire departments that said, you know, we have our own webpage, we have our own social media. We had a fatal fire in our community, and we're looking for information to get out. And we were able to steer them towards, you know, go to the social media. We got a lot of, as Kelly said, pictographs. We call them infographics in the state of Michigan, but we taking the information from the NFPA, the best practices, a great resource, Kelly. I'm glad you shared that earlier. And we took that information and we're putting it out on a daily basis with the idea that we don't want people just to look at it, we want them to share. And if you go and look at MI Prevention Facebook, you'll notice that we're getting, you know, in some cases 20 to 40 shares a day. And we're seeing reaches of some of our infographics and stuff that we're putting out is, you know, we've gotten about 30,000 views. Pretty grassroots, doesn't cost a lot of money, and that's what we really like about it. So one of the things that Kimberly's moving forward, getting all of that out. We had the ability to get the smoke alarms out there, and we started to visit homes. But I need to stop at this point though, and I need to bring the story kind of back. So in 2018, you know, we get the grant, and we're getting this what would become our community risk reduction effort was rolling forward. But we also realized that community risk reduction is more than just smoke alarms. It's more than reducing fire fatalities. It's how to reduce problems that are affecting our state. And that's the way that we really approached it. And I was very fortunate. The young lady who's on the call today, Sharon McNabb, who spoke at the intro from the National Carbon Monoxide Awareness Association, reached out to my assistant, Holly Metz, and said, hey, I would like to meet with the fire marshal. And we had a meeting with Sharon, and Sharon came in and, you know, was explaining to us, you know, how low levels of carbon monoxide, even how they're affecting the general population. But what was even the number that she threw out that kind of alarmed me more than anything was that she said about 12 to 14% of the homes in the United States have a CO detector. We start looking at that and you're going, wow, that's a small number. And she questioned me at the time of why is it if she used a number, I think it was 40 or 50% of the homes have smoke alarms, but a very low percentage of the homes have carbon monoxide detectors. And I shared with her, going back to my time with the Grand Rapids Fire Department here in the state of Michigan, that municipal fire department that I work for, is that, you know, the firefighters, especially it seemed after fatal fires and different things in the community, there was community outreach. There was get out, put up smoke alarms, put out smoke alarms. But I don't think we addressed the carbon monoxide issue. So that's one of the things I want to thank Sharon for, you know, seeking out this new fire marshal back in 2018. And for us getting together and talking. And it's really neat to see how we're starting to move forward. And without Sharon, I wouldn't be able to share our story here with all of you today. But we're going to do some great things, and I'll talk about that a little bit in the future. So we've got Sharon on board. She's partnering with MI Prevention. We're trying to roll this out. We're trying to get into these home safety visits. And it's interesting. I really liked looking at the data that you saw coming from the UK talk about, you know, Professor Shaw talks about, you know, he couldn't have gotten the data that he got if it wasn't for the firefighters. And I'll say the same thing here in the state of Michigan. We would never be able to get into the amount of homes that we get into in the state of Michigan without the fire departments. And those are the key parts. Those are the partners. Those are the relationships. And what we found a way that $525,000 didn't go very far, but it went far enough that I was able to collect data. I was able to show the folks that I work for within state government that they needed to invest in safety. And when I say invest in safety, we have been putting in somewhere between $200,000 to $300,000 every year into alarms. And one of those things that we're really trying to focus on is that we know that we have some homes that are lacking smoke alarms. And we know that because based on the fatal fires that we have and the information that we're getting back is showing us that they did not have working smoke alarms at the time of that fatal fire. But even more so, we're creating this culture within the Michigan Fire Service that the firefighters who are going out into these homes, whether it's on the calls or the rescue calls they go on, or to go out to do a home safety visit, are recognizing that there's also a need for carbon monoxide detectors. So we're working hard to increase that number so that we can get more and more. And I think it's interesting to see in the UK, there's still a lot of work to do on making sure that everybody has a carbon monoxide detector. So one of the things that we've been able to do is with the help of 318 fire departments that are on board working with us, who are actually going out and doing these home visits. And I talk about the resources that we were able to get through the grant and then through the budget. It's one thing to have the resources and another thing to coordinate this all. And that's where Kimberly really comes in. Kimberly is that conduit to the fire departments. She's coordinating, getting them the alarms. We're buying alarms, we're moving them throughout the state. And Michigan is a big state. If you were to start down on our border near Ohio and go all the way to the far end of the Upper Peninsula, which is up by Minnesota, you would have about 12 hours riding in a car one way. So how the logistics of moving stuff around and everything, but what it has allowed us to do across the whole state of Michigan by working with these 318 fire departments and growing daily is we've been able to get inside of 10,234 homes. And we've actually installed 8,144 carbon monoxide detectors and 28,846 smoke alarms. But even more importantly, when we're in those homes, yes, it's great that we're putting up these alarms, and yes, it's that early warning that hopefully folks will leave, is that it's that ability to do that education. And that's what I've heard a lot about today is the education part. How do we get into homes? How do we engage with the folks? My good friend, Fire Marshal in Maine, Joe Thomas, shared, we've got a population aging in place in Michigan also. The baby boomer population, it's a big segment of the United States, and we're going to see moving forward more of them living alone. And in fact, as we were looking at some of the earlier presentations, it was interesting to see that some of the information that was there that shared, folks living alone over a certain age, a certain amount of income. We've even drilled it farther down with our data, especially using the fatal fire data. We're able to even look at the housing stock where most of these fatalities are occurring in our fire deaths. Now, what we really do is we need to leverage this data is how do we get to measuring better our carbon monoxide responses in the United States across Michigan so we can get a better idea of who are the demographics that, yes, we want everyone to have a carbon monoxide detector, we want everyone to have a smoke alarm, but we also need to look at what part of the population is at the highest risk. Like I said, on our fire side, we're dialing it down to, homes built in the 40s, 50s, and 60s, 70s, between 800 and 1,100 square feet. Most of our fatal fires occur in homes that are owner occupied. This gets back to what Joe was saying, was we got folks aging in place. People are going to stay in their home as long as they possibly can. And what did surprise me a little bit was the infographic back to, I believe Daryl presented, where he shared that 34% of the folks in his study area had some form of disability. We're seeing that our fatal fires in our state are running at about 33 to 34% also. So, how do we engage? And that's where Kimberly has really worked hard to develop these relationships with the disability community here in the state of Michigan. We've actually bought some specialty alarms, working with Sharon from the Carbon Monoxide Awareness Association. We're taking the data that we're now collecting, we're taking the interest of the fire rescue folks who want to be involved, and we're actually putting this into motion and we're getting some things done. So, I got to give a big thanks to Sharon. I got to give a huge thanks to Kimberly Pachkowski, because without these two ladies, Michigan wouldn't be where they're at today. And also the 466 people who are our partners who are very involved in MI prevention. It's really neat to see this whole statewide movement occurring. What has come out of that movement, though, I think is even more impressive. We are in the process, and Sharon's in the process of putting together a carbon monoxide coalition. And what is this carbon monoxide coalition going to do for us? It's going to get us all sitting at the table so that we can talk about what's changing in not only Michigan, but what's changing in the United States. And I'm actually hoping that we're also going to get what's changing across the world. And I think that's the collaboration that's happening today, is that we're taking our friends from the fire rescue industry in the UK, and we're leveraging that. And that's even one of the things that we're starting to see, this group called Vision 2020. I don't think it's been brought up here today, but we have this group of really fire service groups and professionals. The NFPA is involved, all the major fire groups, the US Fire Administration, and this Vision 2020 group. We're looking at how do we all work together so we have the same message, so we're getting it out there and we're having this effect. And we're starting to see that really ramp up with community risk reduction. This February, this coming February, they're having their Symposium 7. Kimberly will be speaking at that conference, talking about the things that we are doing here in Michigan. And that's one of the things that, we're trying to, I've said this from the start with the group, is I didn't want to have a community risk reduction program. I wanted to have the best community risk reduction program. And in the process of striving to work towards being the best, we're gaining a lot of partnerships along the way. One of those would also be with the National Fallen Firefighter Foundation. So in the United States, we honor those who have fallen in the line of duty, but also we have a side of it that's called the Everyone Goes Home, which is more working with firefighters. And the Everyone Goes Home side of the National Fallen Firefighter Foundation is providing education to firefighters so they have more awareness. And Sharon shared with me that she's in the process of, they've got a relationship formed with the National Fallen Firefighter Foundation, and there's going to be educational programs that will be available on a video platform soon, probably in the next year. There again, grant funding and some of the other stuff that has to come together, but it's going to give us the ability to educate firefighters, because that's what I hear across the state of Michigan. I thought I knew something about CO, and then we get Sharon at meetings and stuff and get her talking at conferences, and the fire service is saying to me, Kevin, we have no idea about what we don't know about CO, and we're trying to change that. And we're very close. I'm getting some good vibes on a grant that's going to come our way, and it's going to help us to implement a program here in Michigan. It's to be called Protecting the Protectors. The Protecting Protectors program is going to put a personal CO monitor on med bags of every fire department in the state, but it also is going to allow to take a device, which is a blow type device where the firefighters can blow into it. It can get us immediate carbon monoxide level readings in their bodies. And it looks like we're going to get that funding. It looks like we're going to be able to implement this Protecting the Protector program. There again, not possible without the collaboration that has come from the relationships that we've all formed, going all the way back to 2017 as a new fire marshal through today. And that's one of the things that, I'm very excited about is what does the future look for MI prevention? What does the look for the future of how do we protect our firefighters? Because that's just as important also is, a couple of speakers have talked about the PPE needed to go into some of these situations and when to wear it and when not to wear it. The idea here is that we got to continue to bring awareness to carbon monoxide. And with that being said, last April, our Governor Gretchen Whitmer actually proclaimed the month of April in the state of Michigan as Carbon Monoxide Awareness Month. We're already getting together to put together our presentation or to get that proclamation for next April. But one of the things that Kimberly was able to do working with Sharon is daily messaging on carbon monoxide. We need to get that out there, and we'll continue to do it. I think we've got the right group of folks that are on the call today, that are on the panels. I think the fire service can pull this one off in the sense that it is the best way to get out and get into these homes and to educate people. And I look forward to being part of that. And thanks for the opportunity to be here today. And I look forward to interacting with this group more in the future. So Craig, keep up the great work. You're doing great work in the UK. We're doing great work here in the United States. And boy, if we put all this together internationally, imagine where we can be in a very short time period, because we're not that far away from really breaking out and getting more awareness of carbon monoxide. So thank you.
Brilliant. Thank you, Kevin. And I mean, I've only had the opportunity to be involved in this arena since June this year. And the one thing that struck me about the people I spoke to in the UK is the amount of passion and dedication to really keeping the public safe and also the communities. And that has come across as well from our counterparts in the US. I think the fact that we've managed to do it over Zoom and we've done it transatlantic, there's been a few technical difficulties, but it's gone okay. And there's just so much brilliant work that's happening out there. I'll pause to ask some questions or for people to put some questions in. But for me, all we wanted to do today was to try and give people a flavour of some of the work that's going on out there, to try and create that bit of spark so that if people are thinking about running their own initiatives, they know they're not alone, they know that there's opportunities out there, and then now, hopefully, this will be the start of some networking where people can share ideas, share resources. We've seen the resources that we've got in the UK. We've seen the resources that we've got in the USA as well. So for me, this is just the very start. It's now time to develop those relationships. And I think with the passion and commitment that's come across today, that shouldn't be a problem at all. I'll pause to see whether or not we've got any questions that come in. I think Laura had one, but I think it's going to be passed to Bryn. So Bob, did you have a question that I missed earlier? And if anyone else has got any, do you want to stick them in the chat?
Bob, if you want to unmute yourself, you should be able to answer ask the question now. Sorry, I didn't get to you in the previous session. Maybe Bob can't unmute himself. I don't know. Just find the question here.
Okay. Is there, I mean, I think Rachel had some questions for Kelly, but I think that's been sorted. We've got some comments in about the Think CO training. That's really positive. I can't see any other questions sitting in there. If you can see any, Adrian.
I can't see any, no.
Okay. Well, you know, listen, I mean, we're ahead of time. I'm happy to sum up and close. I think thanks to Adrian and Natalie for putting on today, and thank you to all the speakers and all the people who've attended. The one thing that struck me when I've been looking at the attendee list is everybody here is an interested party. I think if we can all go away and try and find some people who are on the fence or only slightly interested and start to kind of build a bit of momentum, then as Kevin said at the end of his, you know, there's a really, really good opportunity for us here to collaborate and bring some of that work together that's happening in pockets and really develop it and learn from one another. I look forward to working with all of you in the future. I really do. It's an area that I'm really passionate about, and I'm just really grateful for the opportunity. On behalf of the National Fire Chiefs Council, thanks to everybody who has spoken today and taken that time. Adrian, have you got anything you'd like to say to finish, and then we'll close down the session?
No, just to thank all the organisations who've been a part of making up the agenda. It's been really, really packed, so perhaps we haven't had enough time to talk about the, so I hear my children getting excited in the background, as ever, whenever I'm on one of these calls, it seems to happen to me. As I think, as Craig said, I think this is only the beginning. I think there's lots of opportunity for collaboration around the awareness and education programs. Obviously, given the organisation that I represent, I'd like to see more collaboration around how we can get some better data, how we can understand better the causes, and how, you know, just you know, my experience of talking to policymakers is they ask how many and how much. And I think those two questions are difficult to answer when it comes to CO exposure, certainly in the UK. But what I've seen today is that we were a very, very committed group of people all working towards a common goal. So it's really exciting. So thanks to all the panelists and thanks to everybody who's attended today. What will happen is we'll make all of these presentations available on the CO Research Trust website. An email will go around to everybody who signed up and the panelists, and you'll be hearing from us again, I hope. And in the meantime, if you have any questions or thoughts, don't hesitate to email me. Thank you.
Thank you so much, and have a good day wherever you are in the world, and look forward to seeing you all in the future.
Thank you all very much. Wonderful job.
Thanks,
Brilliant. Thank you.
Thanks a lot.
Thanks.
Cheers.
See you later. Bye.
Bye.
Bye-bye.
everyone.